Welcome back to Niko's Perioperative. Because staying curious makes all the difference. Today, we're taking a deep dive into something that's always top of mind for us as anesthesiologists, predicting cardiovascular complications in patients undergoing major non-cardiac surgery.
It's a challenge we face every day, for sure.
Absolutely. And to really get into the nitty-gritty, we're focusing on two specific biomarkers: high-sensitivity cardiac troponin THS-CTNT and N-terminal pro-B type natriuretic peptide, or NT-proBNP. You provided us with a prospective cohort study from Anesthesiology that digs into their association with various postoperative outcomes, as well as an editorial from the same journal that really pushes for routine preoperative troponin testing.
Both really thought-provoking pieces.
To start off, the editorial hits us with a stark reminder of just how significant postoperative mortality is. It's the third leading cause of death worldwide. That really sets the stage for why we need to be so vigilant about predicting these complications. We've got tools like the Revised Cardiac Risk Index, but they aren't always perfect, especially across diverse patient populations. What are your thoughts on their limitations?
Well, they often rely on broad clinical factors and might not capture the subtle nuances of individual patient physiology. That's where these biomarkers, HS-CTNT and NT-proBNP, come in. They offer a more granular look at cardiovascular risk.
The study found that elevated levels of both biomarkers, especially when considered together, significantly increase the odds of various postoperative cardiovascular events. They even provide specific odds ratios associated with different biomarker levels. For instance, patients with HS-CTNT levels at the 75th percentile had nearly double the risk of experiencing any cardiovascular event within 30 days of surgery compared to those at the 25th percentile. That's pretty compelling, right?
It is. And what makes this even more intriguing is the concept of fraction of new information that the study highlights. Adding both HS-CTNT and NT-proBNP to a risk prediction model substantially increase this fraction, meaning they bring unique and valuable information to the table.
So it's not just about using one or the other, but rather leveraging both for a more comprehensive assessment. Now, the editorial goes all in on advocating for routine preoperative troponin testing. What are your thoughts on that?
I think it's a provocative proposal, and one that deserves careful consideration. Troponin is readily available, highly sensitive, and as you mentioned, the number needed to screen to detect myocardial injury is remarkably low, just 8 patients in this study.
That's a powerful statistic, especially considering that the editorial states around 20% of surgical inpatients already have elevated preoperative troponin levels. This isn't just about predicting complications, but uncovering potential issues that might otherwise go unnoticed.
Absolutely. And while an elevated troponin doesn't always mean an active heart attack, it certainly warrants further investigation and discussion with the patient. This might involve lifestyle modifications, additional cardiac workup, or adjustments to the perioperative management plan.
The editorial really drives home the point that we need to be proactive, not reactive. When it comes to managing these patients, they even use the phrase, "it's time we do," to emphasize their call for routine troponin testing.
It's a strong statement, and it reflects a growing awareness of the potential benefits of this approach. However, there are practical considerations to address before we can fully embrace routine troponin testing.
Right. Cost, logistics, workflow integration, clinician education, these are all factors that need to be addressed.
Yeah.
But before we delve into those challenges, let's first explore how this information can be practically applied in various clinical scenarios.
That's a great next step. Let's take what we've learned about these biomarkers and see how it can inform our decision-making at the bedside. Let's say we have a patient scheduled for a major abdominal surgery, history of hypertension, diabetes, but they're relatively active. Their revised cardiac risk index score is low. On the surface, they seem like a pretty standard low-risk patient.
Right. Someone we might not typically be overly concerned about from a cardiac standpoint.
Exactly. But then their preoperative troponin comes back elevated. It doesn't necessarily mean we cancel the surgery, but it does change the conversation.
It's a bit of a curveball. How do you approach that conversation with the patient?
Honesty and transparency are key. I explained that while their overall risk initially appeared low, this elevated troponin suggests a potential underlying issue that we need to address. It's about shared decision-making, discussing the potential implications, and exploring further investigation.
So things like an EKG, an echocardiogram,
Yeah.
maybe even a cardiology consult, depending on the situation.
Exactly. And based on those findings, we might adjust our perioperative management, more invasive hemodynamic monitoring perhaps, or a more cautious approach to fluid management in some cases, We might even consider postponing the surgery to optimize their cardiac status.
So it's about individualizing care, not just relying on a one-size-fits-all approach.
Absolutely. Now let's flip the scenario. An older patient coming in for a hip replacement. They've got some mild COPD, limited functional capacity, and their revised cardiac risk index is moderate. So on paper, they appear to be at higher risk.
Right, someone we'd definitely be watching closely.
But what if their preoperative troponin and NT-proBNP are both normal? It doesn't completely eliminate risk, of course, but it does provide reassurance that their cardiovascular system is in relatively good shape.
So these biomarkers can help us fine-tune our risk assessment, both upwards and downwards. It's about seeing the whole patient, not just the risk score.
Precisely. And this is where I think these biomarkers can be really impactful. They can nudge patients towards healthier choices. Imagine telling someone, your troponin is a bit elevated, which suggests an increased risk of heart problems. That can be a powerful motivator to finally quit smoking or get serious about exercise.
It makes the risk more concrete, more personal. It's not just an abstract number on a scorecard.
Now, I know the editorial really pushed for troponin, but the study did show that both HS-CTNT and NT-proBNP offered valuable insights. What are your thoughts on the role of NT-proBNP?
Well, the editorial did acknowledge its advantages. It's less expensive and available as a point-of-care test. But I think the focus on troponin makes sense. It's incredibly sensitive, and we need a baseline level to interpret any postoperative results anyway.
Good point. And while this study focused on HS-CTNT, I wonder about the applicability to other troponin assays, like troponin I.
The editorial touched on that briefly, mentioning that there are various troponin I assays out there, each with its own quirks, unfortunately.
Yeah.
We don't have clear cardiovascular risk prediction ranges for most of them.
So more research is needed to clarify their roles in preoperative risk assessment. But for now, it seems like HS-CTNT is the front runner.
Absolutely. But let's not forget the bigger picture here. The goal isn't just to predict complications, but to prevent them. Identifying high-risk patients early allows us to intervene and optimize their health before surgery.
It's about prehabilitation, getting their blood pressure and blood sugar under control, maybe even a short course of cardiac rehab, anything we can do to bolster their cardiovascular system and minimize the risk of complications.
I noticed the study primarily focused on 30-day outcomes. Did it mention anything about the potential impact of these biomarkers on longer-term outcomes?
They did note some associations between both NT-proBNP and HS-CTNT, with complications and even death at 180 days. But the improvements in risk prediction for these longer-term outcomes were modest. It does raise an interesting question, though. Could these biomarkers also reflect a patient's overall resilience, their ability to bounce back after a major surgery?
That's fascinating. An elevated troponin might not just be a sign of immediate cardiac risk, but also a broader indicator of their overall health and capacity to recover.
Exactly, and that's something that warrants further investigation. Could these biomarkers help us identify patients who might benefit from more intensive postoperative care, perhaps earlier physical therapy, closer follow-up with their primary care physician, a more personalized approach to recovery?
So we've explored the potential benefits of incorporating these biomarkers into our preoperative assessment. But the editorial's call to action for routine troponin testing raises some important questions about feasibility and practicality.
Right. There are some logistical and even ethical considerations we need to address before we can fully embrace this shift.
Let's dive into that debate and unpack the complexities of making preoperative troponin testing routine. We've talked about the potential benefits of routine preoperative troponin testing. But as with any major change in practice, there are bound to be hurdles. What are some of the challenges we need to consider?
Cost is often the first thing that comes to mind. Even if individual troponin tests aren't terribly expensive, scaling that up to every patient undergoing major surgery could have budgetary implications.
That's a valid concern. And it's not just about the cost of the test itself.
Right, exactly. We need to think about how to seamlessly integrate troponin testing into our existing workflows. How do we ensure timely ordering and processing of these tests, especially in a busy hospital setting? And how do we communicate the results efficiently to the entire surgical team?
And let's not forget the human factor. We need to make sure everyone understands how to interpret these results and what actions to take based on those findings. We don't want to trigger unnecessary anxiety or overreact to mildly elevated levels.
Clinician education is key. Clear guidelines for interpretation and management are crucial to ensure that troponin testing leads to appropriate and beneficial actions, not just confusion or over-testing.
The editorial also briefly mentioned the possibility of false positives. How much of a concern is that?
It's something we need to be mindful of. We know that troponin can be elevated for reasons other than cardiac ischemia, things like chronic kidney disease, or even strenuous exercise. So it's important to consider the clinical context and not jump to conclusions based on a single elevated troponin result.
That circles back to the importance of clinician education and thoughtful interpretation of these results. We can't just treat the number. We need to treat the patient.
Absolutely. And this brings up another important consideration: informed consent. Do patients fully understand what they're consenting to when they agree to preoperative troponin testing? Do they understand the potential benefits, the risks, and the possibility of further testing, or even delays in their surgery based on the results?
Those are crucial questions. We need to ensure that patients are actively involved in the decision-making process and that they understand the implications of this testing. It's about shared decision-making, not just ticking a box on a consent form.
I think that's a great point to emphasize. The potential of preoperative troponin testing is exciting, but we need to approach its implementation with a thoughtful, measured, and ethical framework.
It's not just about ordering a test, but about fostering a culture of proactive, personalized care. It's about looking beyond the immediate surgical event and considering the patient's long-term cardiovascular health.
It's about empowering patients to be active participants in their own care and to make informed decisions that align with their values and goals.
Well said. As we wrap up this deep dive into preoperative cardiac biomarkers, I'm left with a sense of cautious optimism. This research highlights a promising avenue for improving patient care, but it also reminds us of the importance of thoughtful implementation and ongoing evaluation. There's still much to learn, but that's what keeps our field moving forward.
Absolutely. And it all comes back to that fundamental principle: stay curious,